Today I would like to show a repair case. So nowadays repairing a transplant surgery is quite common. We see many cases per month. These repair cases are happening because probably patients are not choosing the best clinics or best doctors. And this gentleman is around 28 years, had a transplant surgery 2 years back, some other clinic. The outcome was so disastrous, and of course they did FUT. Even FUT can be done very well. On the backside you can see the scar, but this is a kind of a very bad scar, and the architecture of the design of the strip also, that's completely wrong. That's thing. And even the implantation in the front, if you can see the hairline, it's horribly gone wrong, and someone has implanted hair the way they want. It doesn't make any sense, and the outcome is kind of disastrous, and it did not serve its purpose. So this gentleman appeared in my consultation for getting the spoiled hair transplant repaired, because he heard a lot about us, and even his couple of friends underwent transplant with us. So with their confidence, he came back to my consultation, and on examination I could see many good donor grafts are available, and hairline can be corrected. So this first transplant went failure when even when you combing style, if you see the horribly placed hairline which was not natural, the angulations were also not natural. So that's what the story of this patient. So we have decided to repair this transplant with good results. So basically in the repair we need to plan it. Planning in the sense, in couple of patients we need to remove the grafts also. At times we're going to redesign the hairline. Many things are there in this. So basically be concentrating in this patient hairline rectification and getting the more density, slightly in the mid scalp also. That's what it is. These results what you are seeing after 8.5-9 months, and an excellent transformation happened in this case, because the artistic work and availability of good grafts definitely makes a different kind of transformation. And if you can see the density in the natural hairline, that's so natural, even left side view and right side view, and it's kind of blending very naturally, and a thick density, very beautiful and natural hairline. And if you see in the mid scalp, the density blending is excellent and amazing. This will happen just not because of only transplant and implanting the grafts, kind of how better we're going to execute the surgery, kind of angulations and orientation of the grafts placement and design before the transplant. It makes a lot of sense. See, when patient comes to the consultation itself, we need to understand what are the dimensions of the scalp size, and what are the grafts going to be available, what are the plan, what is the style. A surgeon should have a great aesthetic sense to achieve best outcome. So with that, you can see a beautiful transformation in this gentleman, and donor backside is protected and saved very well. So that's called donor management also. If you can see the natural hairline, combing style and everything, unbelievably natural. So that's the kind of goal of the transplantation surgery. So when you make the choice getting to the clinics, most of the patients will ask us why it is so different from their clinic to clinic, or why the cost is different, why the techniques are different. They'll ask you. None of these techniques can get you a best outcome for you. It is only a beautiful surgeon's hand, skill, and kind of a better execution way, and meticulous surgery steps, because each and every step in the procedure is most important. When going to harvest the grafts, what kind of grafts we are going to implant in the hairline, what kind of grafts we are going to implant in the mid scalp. These are the things which can make a beautiful outcome. A simple just transplant surgery, getting it done everywhere, doesn't make any sense. So always guys, better to choose the best clinics and best doctor. Most welcome to Pioneer Clinic to get your best results. Keep watching our channel for more authenticated repair transplantation results.